You just saw blood in your semen. Pretty scary, right? It is called hematospermia, and it can definitely make you panic. But here is the thing. Most of the time, it is nothing serious. Really, we are talking about a condition that usually goes away on its own. Getting the right information can save you a lot of worry and keep your life and your relationships on track. So, blood and semen. What causes it? It is pretty rare, but when it happens, people often jump to conclusions about cancer or STIs. Let us clear that up. Often it is just temporary. Maybe you had a medical procedure recently, like a prostate biopsy or a vasectomy. That is a common reason, and it usually clears up in a few days or weeks. Infections or inflammation are big culprits too. Think about things like prostatitis, that is prostate inflammation, or issues with your seminal vesicles. Even some STIs, like chlamydia or common bacterial infections, can cause it. If you are a younger guy, an infection is a really likely cause. A quick round of antibiotics usually fixes it. Is it cancer? That is what everyone asks. The good news is, it is very, very unlikely, especially if you are under 40 and have no other symptoms. Sure, prostate or testicular cancer can be linked, but it is rare. Other less common reasons include cysts in the ejaculatory ducts or even high blood pressure. But again, for most guys, it is not a scary disease. When should you worry? If you are under 40 and this happens just once without any pain, fever, or weight loss, you might just wait it out. It often resolves on its own. But if you are 40 or older, or if the blood keeps showing up, comes back, or you have other symptoms, then it is time to see a doctor. Do not delay. A urologist is your best bet. Your first stop might be your regular doctor. They will ask about your medical history and do a quick checkup. They will want to know if the blood is definitely from you, not your partner. They might check your blood pressure, test your urine for infections, or do some basic blood work. They might even check for STIs. If you are over 40, or if the problem continues, they will likely send you to a urologist. This specialist will do a digital rectal exam to check your prostate. They might order a PSA blood test, especially for older men. Sometimes they will use imaging. A scrotal ultrasound can look at your testicles. For older men, an MRI of your pelvis can give a good look at your prostate and seminal vesicles. They are looking for anything unusual, like a cyst or a mass. Most of the time, they find nothing serious. Treatment really depends on the cause. If it is an infection, you get antibiotics. If it is inflammation, maybe some anti-inflammatory meds. Many times, it just goes away without needing anything. For stubborn cases where no cause is found, some medications might help. For example, some doctors use finasteride. Very rarely, surgery might be needed for a blockage. This whole thing can really mess with your head, right? Fearing cancer or STIs can kill your sex drive, cause erectile dysfunction, and put a strain on your relationships. Your partner might be worried too. It is okay to feel that way. Talking about it with your doctor is part of the healing process. Can it affect fertility? Sometimes. If there is a chronic infection or blockage, it could impact sperm quality. If you are thinking about sperm banking, blood in your semen is a concern because it can damage sperm. So that is another reason to get it checked out. So if you see blood in your semen, take a deep breath. It usually is not serious. Cancer is rare, especially for younger guys. Most causes are treatable or just disappear. But please do not ignore it. If it keeps happening, you are older, or you have other symptoms, see a urologist. Getting answers means peace of mind, and that is vital for your health and your sex life.
This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. Get on-demand, concierge-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations associated with traditional medical visits. Take control of your health anytime, anywhere. Visit globalmenswellness.